health aspect of this, because Dr. Ellerman, you heard President-elect Biden say there that this isn't just about the economy, that it is a public health issue. And he's pointing out things like people need to have paid leave so that they'll actually stay home when they're sick and don't go out and spread this virus. And states and cities need more aids for their COVID response. How much of this bill, how crucial is it, do you think, to the public health aspect of all of this?
Diane, this is crucial. The risk to all Americans right now for getting infected with COVID-19 is at a historic high. Yesterday, there were nearly 3,000 deaths in one day. I mean, our baseline is unacceptable right now. We need to make sure that people are staying home, that they have the ability to work from home, that they are being masked in their homes. The CDC just came out with guidance, like you had mentioned before, that not only do we need to mask in public, but we need to mask in our homes, because as fall and winter approach, as the temperatures get colder, most of these transmissions are going to be happening indoors and in our own homes. So right now, I want to be clear. COVID-19 is the leading cause of death in the United States. It has surpassed heart disease. It has surpassed cancer. And we have to get on top of this, or there are dark days ahead.
And he was also asked about his plan to ask Americans to wear masks for his first 100 days in office. He implied or outright said that he believes by his leadership, if he shows by example, if the whole team shows by example, and the American people see that leadership, they may change their behavior. Given your experience with patients, do you see that being effective?
I do. I mean, you know, we've seen from multiple studies that masking reduces transmission by up to 70%. The parts of the country in our communities that are masking more have been less hit by COVID-19. So I think this is very important. I do think this is the type of message that we want to hear. It's a singular message. And if he leads by example, I'm really hoping that the Americans that have been less apt to wear these masks are going to do that, because these will save lives.
And on the vaccine distribution, there was something he said that kind of raised my eyebrows. He's saying that as far as he has heard so far, he has heard no detailed plan to get the vaccine from container to syringe, especially given the low temperatures that we know the Pfizer vaccine has to be stored in. Does that concern you?
So, I mean, to say this is a logistical challenge is sort of underplaying it. But please remember that both Moderna and Pfizer's vaccines can be refrigerated as well. With Moderna, it's at least 30 days, and with Pfizer, it's 5 days. So there is some wiggle room. With that said, the Pfizer vaccine has to be placed on dry ice, and I'm afraid right now that because less people are driving, there's less need for gasoline. As part of that production is ethanol, and with the production of ethanol, one of the byproducts is carbon dioxide, and that's how you actually make dry ice. So again, there are challenges with supply chain as well. But my hope is that, you know, a lot of thought and money has been put into this, and I do believe that we are going to be successful in the end.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.